The health risks associated with climate change cannot be overstated. Beyond drastic changes to our weather, increased risk of natural disasters, and also destruction of the natural world, there is also an immediate risk to our health. This summer, smoke from forest fires in Canada impacted people's health across Canada and the US, and even in Europe. Air pollution is projected to be responsible for 1 in 5 deaths annually, and it's now the single biggest cause of premature death globally. Fossil fuels also contaminate water and land, placing those living on the front lines of production at risk. In this session, we're going to look at the scientific estimates behind these alarming figures, and we will hear from experts on what can be done to clean our air and preserve healthy environments for future generations. Let me hand it back over to Nick, who's moderating this session.
Thanks, Katarina. Thank you very much indeed. I've got 2 wonderful guests with me here, and I'm told that we might have somebody in on the magic of Zoom as well, if that is indeed the case. But if not, the 2 fantastic people are more than enough to keep us going here on this wonderful show on, well, air pollution, really, health and climate change. And this is part of our series with the fossil fuel non-proliferation treaty, or it's certainly fitting in very closely with what we're discussing about that treaty and what we need to do to get rid of fossil fuels. So great. Marina, we had you on the other day, Marina Romanalo, who's executive director of the Lancet Countdown, and you had this report that came out just earlier. It's great to see you back. Air pollution. What is the science telling us about air pollution and health? With this nexus of climate change, of course, right there.
Well, air pollution is a big silent killer. Air pollution is one of the main causes of death globally, and it particularly affects vulnerable populations. It affects young children. It affects their development, their respiratory system development. It affects the risk of cancer as they grow older. It affects the digestive system. It affects the neurological system. So it has a huge burden on our bodies and our health. And a recent study that just came out suggests that the death attributable to air pollution that comes directly from the burning of fossil fuels could be as many as 5.1 million globally. Our estimate had suggested it was about 1.2, but this suggests it could be a lot higher than that. So we're looking at a big cause and a big detriment to our health.
And I think, as we've discussed before, I mean, it's not just deaths, is it? I mean, it's actual children with asthma. There was a BBC study just in the Gulf region here from the flaring of oil and gas in this region. And they think perhaps 40% of the pollution here is actually coming from the flaring of the oil and gas. And they interviewed a gentleman whose son is chronically sick with asthma every time there's so much burning. So, you know, it's causing damage, it's causing deaths, and it really needs to be something that's managed down. What else can we say about air pollution? I mean, it also causes damage to even our ecosystems and things like that. Our nature gets damaged by it too, and that's something we need to protect ourselves in the climate change story. We need nature.
Absolutely. The burden to our health systems, the decades of progress we have done in terms of reducing the risk factors to our health, extending our life expectancy, are being undermined because we're getting sick from air pollution. You mentioned young children and asthma. There's little Ella, that it was the first child whose death certificate in the UK say that the cause of her death was air pollution, because she has severe asthma that got exacerbated by air pollution. And it's very important to make that link, that when we're looking at an increase in the cases of asthma, they often have to do with children living in very highly polluted roads. But one thing that I wanted to perhaps turn the attention to is that when we talk about climate change and air pollution, fossil fuels are the main driver of climate change and are one of the biggest single contributors to air pollution. But our inaction is also leading to having families, particularly in the lower middle-income countries, that continue to be highly dependent on the burning of dirty fuels like biomass and other sources of very highly polluting fuels inside their home. So it's the fossil fuels and also everything that we have done not to give access to clean renewable energies to the families that are still dependent on these toxic sources of energy, which they need to maintain their basic lives and healthy lives. So it's so imperative that we do phase out fossil fuels and that we do that in a way that we're delivering access to clean renewable energies in a fair way, in a just transition, particularly to those that are today struggling with energy poverty or that still are highly reliant on the burning of dirty fuels.
Are there any other health aspects from the climate emergency in which we find ourselves in? Are there any other health impacts that spring to mind?
To give you a whole list of health impacts from the climate emergency. Well, look, climate change is fundamentally a health emergency. Everything that is happening to our environment means that we're living in a level of instability of the environmental conditions that affect us directly that we've never experienced before. And we're seeing globally an increase, and this kind of has become a bit obvious now. When I say it, people just see it and feel it every day. I don't need to be saying the numbers, but we're seeing an increase in the incidence of extreme heat events, of heat waves that are leading to death, to increased disease. And we estimate that since the 90s, the mortality related to extreme heat exposure in people over 65 years of age has increased by 85%. And that is more than twice the rise that we would have expected if temperatures had remained constant. So we know that this is mostly climate change driven. And we're seeing, for example, spread of infectious diseases, around 30% more environmental suitability for the transmission of deadly diseases like dengue, that is now spreading like wildfire, particularly in South America, Southeast Asia, and undermining our disease control efforts. And we're seeing, for example, that because of the increased incidence of extreme events, because of our reduction in labor productivity, because it's just too hot to work, and because of the whole economic impacts of climate change, people are not being able to produce food properly or to access the food that they need to meet their basic nutritional needs. And what that is leading to is an increase of 127 million more people today reporting that they cannot access the food they need, they're food insecure. That is directly linked to the increased incidence of heat waves and of drought events. So every single one of the pillars and the determinants of health are being affected by climate change, which is a crisis driven by our persistent burning of fossil fuels, a technology that we know we can replace.
I remember reading, in the days when I was at the UN Environment Programme, a paper, I think from the Royal Society in London, which said that in the past, the spread of infectious diseases, so the spread of existing ones we know and the emergence of new ones, was actually linked with things like people settling down on the land to become farmers. Then it moved to colonialism and the movement of people around the world because of colonialism, bringing stuff from one place to another. You know, it might be food products with something on, or it might be animals. And then it was, and tourism, with people now moving to that. And that now, the biggest source of infectious diseases, whether it be old ones spreading or new ones emerging, was linked with climate change, including things like deforestation, causing all kinds of things like, you deforest and you've got a perfect place for malarial mosquitoes to breed in pools of water because the forest has gone, some example. This is right, isn't it? This is the time we're living in.
That's absolutely right. And all of those other factors are still there.
Yeah.
We're still seeing good exposure because of land use change, which in many cases drives climate change as well. We're still seeing people movement, and we're still having all of those risk factors. And on top of that, we're now seeing that the environment has become so much more suitable for the transmission of these diseases. So what is happening, for example, here in Europe, we're seeing that, well, not here in Europe, sorry, I'm used to being in the UK.
It really confused me there for a second.
Yeah.
I thought I was in Dubai.
No, it's much
so hot
hotter
today.
heater here than it's in London. In Europe, where I live, we're now seeing often that there's local transmission of diseases like dengue. And that is because the environment has become suitable for local transmission, and because people are bringing dengue from abroad, because we have people movement. And that means that we have now a permissive environment that puts us at risk of outbreaks, epidemics, and new emerging infectious diseases are starting to be linked more and more to climate change.
I'm going to, in a moment, I realize that we actually have a video message from Dr. Courtney Howard. So I'm going to bring that person in. That's coming, I think, in a moment, isn't it? So maybe we could we, Stockholm, now do the broadcast from Dr. Courtney Howard, please?
Hi, I'm Dr. Courtney Howard, an emergency physician here in Yellowknives Dene territory in the Canadian subarctic. This last summer, severe wildfires forced the evacuation of our 100-bed hospital, meaning that we had to transfer patients with the help of a military evacuation program down to 2 different provinces, which themselves were also affected by wildfires and smoke. This isn't the first time that we've had such severe wildfires. This is a part of the world that is already over 2 degrees Celsius warmer than when an 80-year-old elder was born. And our hospital serves an area that extends up to the higher Arctic, where it's already 3 degrees Celsius warmer in some cases. That's causing permafrost melt, trouble accessing traditional foods, as well as these terrible fires. In 2014, our study showed that we had a full doubling of emergency department visits for asthma over the course of 2.5 months, in a summer that came to be called the Summer of Smoke, or SOS for short. Our qualitative study found that people felt really trapped inside their houses for that entire time, feeling like they missed their community, they missed their connection to the land, and that they missed the physical activity that they were used to having outside. People said things like, "What does this mean for our kids?" One thing that we also saw was that the people who prepared the most felt better. So what we can see is that taking action relieves anxiety. When there's a real threat, we need to move to actually decrease the threat. And that's one of the things that the Fossil Fuel Non-Proliferation Treaty allows us to do. It gives us a pathway to agency with a realistic mechanism that can really create change. The Lancet has said for years that climate change is the biggest health threat of the 21st century. The World Health Organization now says that too. Aside from severe wildfires, my colleagues across the world are now coping with huge heat waves that overwhelm emergency departments. We're seeing severe storms take out the infrastructure we need to do our work, as well as reduce our ability to access the pharmaceuticals and other supplies required because the supply chains sometimes go down. We're seeing changes in temperature and precipitation patterns mean that different mammals, different vectors, and humans are in new proximity to one another as all of these living beings move around trying to find a good habitat. And what that means is that we're at increased risk for new transmission of viruses and other pathogens into humans. So it's increasing the risk of further pandemics. The good part is that tackling climate change is the biggest health opportunity of our time. Even by decreasing fossil fuels right now, we save lives. Decreasing fossil fuel related air pollution allows us to reduce the almost 1/5 of global deaths that are related to fossil fuel related air pollution. Whether we're talking about cancers or chronic obstructive pulmonary disease or heart disease, these issues are all exacerbated by fossil fuel related air pollution. It also can lead to new cases of asthma in kids. Now, asthma in children is one of the main reasons they come to the emergency department. Think about what that means for kids. It means they're missing school. It means that their parents are missing work. It means that there's a burden on the healthcare system. The children are getting poked and prodded for labs and tests. It's not a good experience for anyone. So as we save the planet, we can save people at the same time through this work. And it really is a gift that the people who are putting forward the call for a fossil fuel non-proliferation treaty are giving to us all. That's why the Global Climate and Health Alliance has partnered with the treaty folks in order to help mobilize the health sector. They didn't teach us how to organize in medical school, but they did teach us to care. And so when provided with this opportunity last year, we were able to get health professionals and health organizations from around the world to join the call for a fossil fuel non-proliferation treaty. And the voices were raised so loudly and enthusiastically and urgently that the World Health Organization itself signed on, lending its voice to the call for a fossil fuel non-proliferation treaty. Heading into COP28 with its very first health day, the call from the health community is clear. The treatment for the health emergency of climate change is fossil fuel phase out. And we see the Fossil Fuel Non-Proliferation Treaty as one of the most realistic pathways to actioning that treatment plan. So we would like to say thank you to the treaty folks for the energy, the love, and the courage that you put into this work. We want you to know that we're there with you, and we look forward to working with you to continue this call to ensure that we can have the healthy planet we need for healthy people and keep this place safe for generations now and generations yet to come. Thank you.
So a big thank you there to Dr. Courtney Howard from Canada, Vice Chair of the Global Climate and Health Alliance. Now let's turn over to another wonderful guest that we have here, which is Bavreen Kandhari.
Yes.
Okay, climate parent at Warrior Mums and Our Kids Climate. And Bavreen is a concerned parent working towards clean air for over 2 decades, spearheading several public movements in Delhi and India generally that bring desperate attention and call for action on clean air and environmental justice issues. She has facilitated the rise and management of social movement campaigns like hashtag My Right to Breathe, hashtag Delhi Trees SOS, and co-founded Warrior Mums with mothers all over the country, all over India, joining hands to bring back clean air. So welcome to you.
Thank you.
What is the state of the air in a big city like, say, Delhi in India? What is going on with that air?
So, I mean, we spoke, we have the doctors who've said it all. I mean, it's air pollution and why it's there, the numbers, everything is there. But we are, there is a misconception that we have air pollution only in this time when it's winter, but it isn't so. We are almost living in the toxicity throughout the year. We had almost, about 4 good days of air, only 4 good days of air the whole year. So this is something that, we're the state, I mean, if you're talking of Delhi. And then the other thing which, because you asked for Delhi, and I would like to point out that it's not Delhi. It's pretty much everywhere. Air pollution has now, what we've been saying and what the experts have been saying, that it's spread its wings. It's probably every city this year, Mumbai and Pune have been even taken over. They took, they were much more polluted. So obviously this is, the state, and this is the reason we are, here, and because of the fossil fuel treaty, we've all, trying to stress on that it's the emissions that are causing this, and this is throughout the country now.
Yeah, I mean, the government of India and the regional governments in India, the national government, the regional governments, I mean, they're breathing the air too, right?
Yeah.
So, and don't they, what kind of, it's been going on for ages, right? So it's not as if it just happened today. So what kind of thinking is going on in India in terms of to deal with this problem?
So it's not that era when they were in denial. They know this is happening, they admit it, and they are doing things, they say things, but it misses in action because you do the wrong things. When it's about the emissions, you're talking about it's curbing the sources of emission is what we need to do, and that means the fossil fuels will have to go. The emissions which are in the city like Delhi, which is more about vehicular and which is about the biomass, like we were talking, the indoor air cooking, those kind of indoor air pollution. Those are the things that need to be worked out, and they have to be worked out with good systemic changes, with policy. Until our policy is not sound, and of course, something very important that we are missing terribly is the implementation. So strict implementation. Of course, you have laws, but if they're not being implemented, then they're of no use. So this is why we are doing the wrong things. We are saying the wrong things, and we're doing the wrong things. We think smog towers will clean air. There was like a huge tower that was put in Delhi.
Yeah.
This is simply ridiculous because these gadgets are not going to clean air. These are all reactionary, and they're wonderful photo ops. So the politicians love these kind of things, and they want to show that we're cleaning air, but that's not going to help anyone. And it quite rightly, it was proven this year that it's not helping.
Sorry, when you told me about this before, I was really listening to it. I was really quite shocked, bemused, intrigued. They put a tower up in Delhi right? And they're gonna use this, or they're using it to clean the air. What does this tower do?
So the tower, yeah, the tower has these, like filters, the HEPA filters, and they, of course, it can clean with the experts as the IITs and all who have shown the data. It can clean up to 100 meters, which is okay, fine, very good. But then how do you become, worry about all the 35 million people who are living there and how it's going to happen? So now with all the research and the data and all this pushing from various, citizens like all of ourselves, it's been now. So they've asked now you put 40,000 towers or you don't put none.
Yeah.
So this is never going to be the solutions. These are distractionary techniques, I would say, that you put things and you try to, because the masses here are not so well educated. Even the regular educated people will not have so much knowledge. But when they see that the government has put something as, wonderful as a huge tower to clean air, then the whole, it's not about the city, the whole country starts talking about it. So this was getting replicated in Kolkata, in, Chandigarh, and various other, in NCR. So this is the thing, that you lead into a wrong direction, then everybody follows you there. You do the right thing, everybody will follow you.
I mean, it sounds like an awful waste of money when you could be investing that in,
and
like,
it's public money.
more renewable energy, for example, or because in the end we have to substitute the fossil fuels with clean energy.
Clean energy.
It's a simple strategy.
Absolutely.
And it has to be done.
Absolutely. The clean energy has to come in, and has to come in fast. The fossil fuels have to go. There has to be an equitable phase out, and it has to be all fossil fuels. There has to be, of course, there's air pollution, which is affecting everyone around, but there are these hundreds and thousands of people who are in the vicinity of the coal fields and coal mines and all, who are actually suffering so much more.
Right.
So we cannot even deny them their right to life and right to breathe. And because we are mothers and we are talking about children, this is how, I think it should affect everybody. My children are, as much as I've been said that we've been fighting this for over 2 decades, but yeah, I have twin girls and they're going to be 20 this year. I don't think their lungs are normal. They will have damaged lungs. Yes. At some point they will suffer.
Yeah.
So it's not fair, and it's not. It should not be accepted by anyone.
Actually, it's funny you mentioned that, because I lived in Nairobi in Kenya for 13 years, and I had 3 very young children when I was there. And they were still, in those days, this is the early 2000s, putting lead in petrol in Nairobi. Fortunately, the UNEP has helped to phase out lead in most petrol that was still using it in most parts of the world. But when we got them back to Britain, we did some tests, and there were little traces of lead in the blood supply. Whereas in Britain, lead was phased out of petrol a long time ago.
Yeah.
What do you, as mums, go and see the government and say what you want, and what is their response?
Yes, it's not going to work otherwise. You have to speak to them. After all, they're the ones, like I said, the policy, it has to come from them. We have to push it. We are moms. The best we can do is, the one thing we do is empowerment, because unfortunately, as mothers and citizens, we are so busy in other things, we don't know the laws ourselves. So if there are violations, like say, how the waste is being burned, or there's vehicular emissions, or a tree is being cut, what are you supposed to do? So we kind of empower them with this information. Every state has different laws. And then the second thing is, like you said, pushing the policy. We meet the policymakers, we work with them. If a smog tower, we shared a lot of data and various other things that we can push them and understand. Everybody is not bad, and we're not bad meaning. They are well meaning, but they are being guided also in the wrong directions. So when you come together, things work. So we are so happy that the smog tower has failed, and it's been said it's been failed, but then it took 3 years of our lives to proving that wrong. And too much time goes by, because the toxicity is affecting our children. Every breath that they're taking, every second that we are speaking, their children are breathing. We are all breathing there. And it's just, difficult to understand that why we do not want to take decisions. I think there are 13 lives every minute that are lost because of burning fossil fuels. Yeah. And I think 3 alone in India per minute. And why can't we just work? It's too many numbers. Why we don't want to save them? It's,
I've got it. Yeah, I've got it. Can we, with the Lancet, obviously the Lancet, known for many people as an outstanding, medical journal, but are there health professionals in India that are a part of your work? Just echoing to this, it's not just a European thing or a US, American thing. Health professionals in other countries?
we have health professionals from many different countries. We have, I don't think anyone currently living in India. We have Indian professionals, but not that are currently living in India that contribute to the report. But we have Indian partners with whom we've done policy briefs, leaning on the data that we produce for India and that they have taken it to government.
That's a ministry? Is it the ministry?
Well, they're not currently in the ministry. They're from public health associations in India.
Yeah.
And public health professionals have really taken the lead in India, as you said, to put this problem, the notion that climate change is a health crisis and that phase out of fossil fuels is absolutely essential for a healthy future. And they've been taking this message to governments, but it's not an easy road. And we know that there's a lot of interest. And that's why it's so important that we endorse the Fossil Fuel Non-Proliferation Treaty and we make the case that we cannot have a healthy future unless we phase out fossil fuels.
Because the challenge is there. We're such a big coal, usage in our country. We have, so it's not easy to immediately phase out. But what you said was so right, that you to work on renewable energy at a very fast pace, and that's going to be the game changer.
Yeah, there needs to be a plan for the phase out of fossil fuels and a plan for the massive ramping of renewable energy. I mean, that's doubling every 3.5 years now globally, so that's pretty good. But it doesn't have the phase out of the fossil fuel plan. We need that urgently. And the nice thing about the treaty is it looks at how you would do that. And this is also important. You need to know how you're going to do it so you don't dump people back in poverty because they have no energy, full stop. So you've got to be careful about that. But look, this is a fascinating topic. We could go on and on and on because it's really exciting. But unfortunately, we have to move on to another show that we've got coming soon. But I want to thank you really for the work you're doing with mums in India. And Our Kids Climate, of course, is a great initiative. Some friends of ours, in fact, Katarina, the other co-moderator, is very much involved in Our Kids Climate in the Nordic region. Yeah.
I think every mom is, every mother, and that's what we try to tell the politicians and the leaders here.
Yeah.
Your parents, just remember that.
Yes.
Before you take any decisions.
They sometimes forget that, don't they? They forget when they come to these negotiations, they forget their mums and dads, and they have their own children. What sort of future do they want for them?
That's why we're here, to remind them. That's why we're shouting, showing up, here at this.
It's incredible. They like turn into interplanetarians, don't they, when they come to negotiations, forget they're human beings as well. Yeah. But Maria, thanks so much for you being here as well.
Thank you, Nick.
I think you do great work, all of you, and let's see how it goes. Okay.
Thank you so much.
So, Katarina, I'm going to hand the show back to you in Stockholm, if that's okay. And yeah, thanks.
Well, thank you so much, Barine and Marina. Just to showcase how powerful love is as a fuel for making change happen, and also to remind us constantly that why we're doing this. Just an hour ago, we had 3 small children in the studio to visit, and it's just a stark reminder of why we need to do this and why we need to step up. And just like Nick said, I'm involved with the organization Our Kids Climate that Barine is also very active in, and was part of the founding of the organization in Paris during the COP28 2015. And it's many organizations that are sort of gathering together in Our Kids Climate, making difference. So thank you, Barine, for showcasing this work and also for making things happen, especially in the continent, in India. So we just have to keep on working and push for change. And this really showcases collective action at its best, that things can happen if we gather together and use love as the biggest and most important fuel.